last day of I am ward. I'm gonna miss a lot of people. Hello everyone, for those of you new here, I'm jaceriales, an MD PhD candidate from the Philippines, and I vlog about medicine, medical school, life of a medical student, clerk and intern, life inside and outside the hospital, and research. If you're interested in these kinds of content, then you may want to subscribe to my channel. A few weeks ago, I shared my internal medicine internship experience, so you can find it here or in the description box below, where I talked about the pre-duty post cycle in internal medicine, the duty roles as an internal medicine intern, and my personal experiences and worst and best experiences in internal medicine. For this vlog, I will be talking about our phase 2 in internal medicine. Check out part 1 for an explanation why there is a phase 1 and phase 2. This is a separate vlog because our duty cycle is different. It's not a pre-duty post anymore, so keep on watching to know more about it. This vlog is divided into 3 parts. A vlog about my last week in internal medicine, the new duty cycle, and my worst and best duty experience during phase 2. Part 1. Here is a vlog about my last week in internal medicine. Enjoy watching! Good morning. It's my last day of IM ward duties and I'm gonna miss a lot of people. Duties from 7 a.m. to 7 p.m. and monitoring ko is 7 to 9. So RD ng isang ward. Post HDM.
Tatanong ko ng maayos.
Brody! Thank you!
Okay, individual. Akala ko tag-isang ba? Shit!
Yeah, it's Barbie and the Cup.
Brody! Thank you!
Gusto na yung isa.
Oo, sige na. Nagpa-fasting na kasi.
Oo, wala eh. Naman talaga. Bye-bye internship.
March.
Eh,
Okay. Ayun.
dapat si Anin. Alam mo na.
Say hi!
I love you and you love me. Misha, ice cream with tea.
Goodbye!
Oh, naiyak to si Jeremy.
Ano iyak?
Love you guys. I love si Brent. Love you guys. Masample nga ng tumbling dyan.
Anong masasabi mo, Mitch?
Patingin natin.
Naiyak yung course.
Happy birthday.
Happy birthday!
Star, binigyan niya kami ng cake.
Aww!
Walang mas.
Ready? Wait lang. Ay, nag-alarm ka.
Closer pa. I think kaya maki-closer.
Closer pa.
Yan. Family ay parang part. Part 2.
Part 1.
On my last day. What if matapon ko to? Hawakan niyo. Parang pagbasa ba?
Okay, 1, 2, smile. Oh, cute.
Thank you, guys.
Pwede nag-blur yung camera mo.
Hindi ngayon nag-invite niyo.
Tara. Bubowling kami. Sama kayo.
Kailan?
Ngayon. No!
Barbie kami ate. Sama kayo.
Ah.
Nine-
Sarita!
So kayo nag-post ako, wala naman ako.
Leslie!
Nino! Kim Chang! Uy, makikita kayo sa
Bye, bye! Bye,
Wala na akong kami.
Bye, Kyle!
Bye! Bye, guys!
Bye! Ano, wala na si Pat. Bye, pa.
Bye,
We meet
bye!
again.
Till we meet again somewhere, sometime.
So,
Ano yung cable?
Kaya pa siya, tayo lahat sa
wala na. Ay, tanong kayo.
Oy, kayo! Oy, perfect!
Gusto magpakita ng ano dati, na pwede kayong may potential.
Mayroon mo sa amin.
Hi, we're going home.
End of vlog.
Nagiging na sa pader. Hello!
Ay, pangit na yung live.
Coffee.
Ang dala pa uwi.
Pag ganito.
Wala namang nangyari. Uy, cellphone! Part 2, the new duty cycle. So it's not really new because it already existed pre-pandemic. This was the duty cycle pre-pandemic. They just reintroduced it because they are dissolving the phase 1, phase 2. So it's a pre-duty post. So there are 4 pre-duties, 1 duty, and 1 post-duty. So the cycle is every 6 days. Meaning, during the pre-duty, there are more interns on pre-duty, so the workload is lighter. The pre-duty is ward duty, so from 7 a.m. to 7 p.m. or earlier if you are already done with the to-dos of your patients. However, during the duty day, the duty is the worst because there are only 5 to 6 interns for 4 wards or more because there are ectopic patients or those patients not in the IM wards but are IM patients. For the duty, it's a PM duty, so from 7 p.m. to 7 a.m. the next day, and Guazon. Guazon, it's like a mini M&M, mortality and morbidity conference, every morning. While for the post-duty, you can just relax. If there are no consultant rounds or senior rounds or any event activities. In those 4 pre-duties, there are 2 pre-duties where you are at TIC or temporary in charge because you have a body where if they're on duty, you are the person in charge for their patients because since they cannot come in during the morning, if they have 3 to 5 patients, so it's additional 3 to 5 patients for you on top of your 3 to 5 patients. For the third part, the best part of this kind of pre-duty post cycle is that you really get to know your patients because during the pre-duties, since you are really the person assigned for everything that will happen or you do to the patient, you can really know what happened, what's happening in their history, their case, their PE, the progression of their disease, or if they're getting better or if they're getting worse, their improvement. You really get to follow the patient more intensely compared to phase 1.
Thank you, Gerard and Monica.
The worst one was where every duty, because there are only 5 to 6 interns per duty, meaning you handle all the patients from 7 p.m. to 7 a.m. the next day, and you also have Guazon pa from 7:30 to 9. So you handle 4 wards, 3 full wards, and 1 ward with still many IM patients, and there are also ectopics from other wards. So since there are only 6 of you, there's the Joapod, there's a RIB runner, the CK kid. So only 3 jualalais where you will monitor all the patients in the 4 wards. So there are a lot of Q1 in IM because since it's a tertiary and referral hospital, they come to you already at a bad or a very bad state. So a lot of them are Q1 or early monitoring. Imagine 3 full wards with a lot of Q1, and there are only 3 jualalais. So each jualalai, or those with no major roles, will be assigned 1 ward to monitor all the Q1, Q2, and sometimes Q4. So there was a time where after the first hour, actually it happens a lot. Nag-second hour na lang, hindi pa ako tapos sa lahat ng imo-monitor for the first hour. So, and I'm assigned sa isang ward. So there are a lot of patients in one ward. And my time na on the last like 2 to 3 hours of our duty, since the Joapod and the CK or census kid needs to prepare for Guazon, so the Jolales will be assigned 1 to 2 wards. So I almost died during the last 3 hours of the duty because I was assigned 2 wards to monitor. And siguro yung hawak ko na patients, no, i-monitor was more than 30. And by the way, monitoring includes BP or blood pressure, temperature, heart rate, respiratory rate, and O2 saturation. And some patients are really difficult to take their BP, as in you need to repeat a couple of times and even do it manually and try it automatically to check if they are really hypertensive or hypotensive. And there are a lot also of desaturations, or the reading on the pulse oximeter is low, so you need to ensure it. You need to test all fingers if they are really desaturating, and you need to intervene as you see their vital signs become unstable. So yeah, it was really stressful every duty, but at least it only happens every 6 days. So that's kind of a win. That's it for now. You may want to subscribe to my channel and hit the notification bell to be notified when I release a new vlog. Thank you for watching. See you in the next one.